Okay, so,
Oh, and please remember to talk on the microphones.
oh, yes. It's my privilege to call the meeting of the Joint Conference Committee of Laguna Honda Hospital to order for today, May 9th. Will the secretary please call the roll?
Sure, I'll start with you, Commissioner Chow.
Here.
And Commissioner Green.
Here.
I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Item 2 is the approval of the minutes of the January 11, 2023 JCC meeting.
Right, so the minutes are before us. Is there a motion for acceptance?
So moved.
And I have a second, and I think my only question was under the Finance Committee. In the public comment, and this is Mr. Monet Shaw's own words, I guess, but at the last sentence, just to be sure that that's not a typo, after all, we've been told LHH relies on $200. If that's the way he wrote it, then that will be it.
I cut and paste and put things into the minutes as they are, so this is as he wrote it. But thank you for noting it. I do see that there's a period missing from the end of his statement, so I'll make sure that if he put a period, I'll add the period.
Okay.
But thank you. May I check public comment?
Yes, please.
All right, folks on the line, I'm going to read a statement. Give me 1 second. For each agenda item, members of the public will have an opportunity to make comment for up to 3 minutes. The public comment process is designed to invite input and feedback from individuals in the community. However, the process does not allow questions to be answered in the meeting or for members of the public to engage in back and forth conversation with the commissioners. The commissioners do consider comments from members of the public when discussing an item and making requests to the DPH. Please note that each individual is allowed 1 opportunity to speak per agenda item. Individuals may not return more than once to read statements from other individuals unable to attend the meeting. Written public comment may be sent to the Health Commission at the following email address: health.commission.dph@sfdph.org. If you wish to spell your name for the minutes, you may do so during your verbal comments without taking your allotted time. Please note that city policies along with federal, state, and local law prohibit discriminatory or harassing conduct against city employees and others during public meetings and will not be tolerated. We will first take public comment from individuals attending the meeting in person. We will then take remote public comment from individuals who have received an accommodation for a disability. I have given each of these individuals a code to speak when they begin their comments to prevent others from speaking during this time. Finally, we will hear remote public comment from all other individuals. There will be a time limit of 20 minutes on the total amount of the remote public comment that can be heard on each time from individuals who have not received an accommodation for a disability. And finally, because of the new remote public comment procedures recommended by the Office of the City Administrator and the City Attorney's Office, please do not raise your hand to make remote public comment on an item until your category is called. So we will begin. There's only 1 hand up, so we don't need to do the categories. All right. Caller, you're unmuted. Please let us know that you're there.
And it's Patrick Manetso. I think my code is WW, Mark.
Yes, please begin.
I want to thank Commissioner Chow for the clarification. It should have been $200 million. I will double check what I submitted to Mr. Morwitz, and I'll follow up with him today on that. I see the minutes included my testimony about Mr. Pickens, slide number 4, asserting Laguna Honda received 124 deficiencies during the first 90-day monitoring survey that ended on December 17th. But the root cause analysis report, as I've mentioned to you before, that was dated January 31st, regarding that same 90-day monitoring survey, had only listed 76 deficiencies, including 56 patient care FTAGs, 20 physical plant deficiencies, not 124 deficiencies. The difference between 76 and 124 is 48. Why do Mr. Vickens and Dr. Colfax keep artificially inflating the deficiencies by 48? They appear to be comparing and contrasting the two surveys, a drop from 124 to 23 in their second 90-day monitoring survey, to wrongly claim significant progress is being made. Again, why isn't the public informed? Why wasn't the public informed in the first root cause analysis report about the other 48 deficiencies? Commissioner Chow himself stated he was concerned about the data discrepancy, which is yet to be explained or clarified. Thank you.
Thank you. That is the only public comment for this item.
Okay, shall we go on to the next item?
Could you two actually do the vote? Even though the remote meeting procedures were that the two of you could just do motions, but we need to actually hear you say, everybody say aye.
Okay, asking for acceptance of the minutes. All those in favor, please say aye.
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 All right, thank you so much. We can move on to item 3, which is general public comment. And I see a hand. All right, Mr. Shaw, you've got 3 minutes.
All right, this testimony is about the proposed settlement of the Superior Court case and about not about agenda item 4. So do not cut me off, please, Commissioner Bernal. The reason San Francisco will soon pay over $3 million to settle this actual second lawsuit filed by the public guardian and public conservator alleging elder abuse of patients at Laguna Honda involved the patient sexual abuse in 2019 due to inept city managers. The other case explicitly names Mybrook Hiroshi as a named defendant. The patient sexual abuse scandal that surfaced in 2019 under Hiroshi turned out to be Laguna Honda's second original sin. That sexual abuse scandal is what brought on both superior lawsuits filed by the public guardian and public conservator involving this first pending $3 million plus settlement that the Board of Supervisors will soon have to approve settling. The second lawsuit named the Department of Public Health, Laguna Honda Hospital, and 25 other unnamed does, possibly including senior Laguna Honda managers. How are those 25 unnamed quote-unquote does hiding behind aliases? Their names should be exposed, and given their involvement, they should possibly be terminated. Thank you.
All right, thank you. That's the last public comment under general public comment. We can move now to item 3, which is the executive team report.
It's item 4.
Oh, I apologize. Item 4. Thank you, Commissioner. The executive team report. And Baljeet, please come and join us. Give me 1 second to get this better formatted. I'm sorry, I think that's the best I can do. Please begin. I'll figure out the formatting as you go.
Sounds great. Thank you, Commissioners, for allowing me the privilege to present the executive team report on behalf of Roland Pickens. We can advance to slide number 3, I believe. The first slide is just for posterity's sake, ensuring that we have all the information there for individuals that are tuning in for the first time. Well, on this slide, I just want to cover a couple things. Particularly, we do know that on February 1st, 2023, CMS did agree to the city's request to continue the pause until at least May 19th, 2023. On this last bullet point is one area I want to focus on today. Whereas regulators initially directed Laguna Honda to pause the discharges of residents who no longer required skilled nursing level care, they have now directed us to resume. Now, it's been our practice whenever possible to work with residents who no longer require SNF level of care and transition them to the community or to other lower levels of care. Now, I do want to describe that process a bit more for the commissioners. And so we have an enhanced process for residents that are without the SNF level of care. So Laguna Honda has put together an interdisciplinary team called the Community Option and Resource Engagement Team, or CORE for short. That meets weekly to help officially identify housing and support programs to more quickly facilitate discharges and to transition the residents back to the community. Now, there's several members of this CORE team, and I'll describe who they are and what agencies they represent and kind of a little bit about what they do. So members of the CORE team are the Human Services Agency, who assist with in-home support services, commonly referred to with the acronym IHSS. It also involves the Department of Housing and Homelessness, which assists with housing and community placement. The Community Living Fund is also a member of this group, which assists with housing and program placement and case management with the Institute of Aging. Then the Institute of Aging, who collaborates with the Community Living Fund for case management. It also includes the DPH Primary Care Leadership, who help establish primary care services, and also the DPH Behavioral Health Team, which assists in behavioral health services such as case management and primary care services. Now, CORE meets to identify the key stakeholders and programs that are appropriate for the referred resident. So, for example, John is ready for discharge. Now, the Community Living Fund would do a meet and greet with John to engage the resident with a discharge plan. The meeting would identify needs and preferences, and the case manager would then present John's interview to the CORE team along with Laguna Honda social workers and physicians for any kind of clarifying information they would need. During these CORE meetings, the group would then coordinate services as indicated for John, such as identifying intensive case manager, securing and confirming those services, identifying any barriers, and then other issues that relate to the client's needs or preferences. Now, throughout this whole thing, it's also important to know that the resident can appeal the process, and they can appeal the process through, for example, their managed care plan, such as the San Francisco Health Plan or the DHCS Office of Appeals. And one other thing to call out, it's important to note that the discharge process, really, the goal is to have it begin upon admission, and it's always ongoing. The resident care teams are completing and updating the resident assessments at least quarterly based on the changes in their needs, resources, and preferences. And it includes resident assessments, identifying discharge locations in the community like I just described, any services and programs, and then working with those locations and services and programs. It also involves in the notices to the residents, the creation of a detailed discharge plan, and then the discharge itself, right, which can take up to 30 days. And then finally, just to repeat what we shared in this venue and other times, is that the assessment entails a review of medical, nursing, psychosocial, behavioral health, and functional needs. And we are providing at least 7 days of notice then to our residents when we're proposing that transfer and discharge. So again, the residents have right to appeal it and do the closure plan and other adverse outcomes of residents' discharge. Under the closure plan, Laguna Honda has added a transfer trauma assessment and mitigation plan to the discharge process. So I just want to spend some time describing that a bit more because I just want to make sure it was very clear about the thought and the thoughtfulness that's being put into this by the teams that are working on these discharges. With that, we can also go to the next slide.
Sure, sorry.
Oh, no problem.
It's very quick.
Here we go. So as part of the settlement agreement, CMS will conduct monitoring surveys every 90 days, and we have now hosted 2 90-day monitoring surveys, and the second survey showed much more progress. We do anticipate another monitoring survey in the May to June window, so that's after the original action plan is complete. Next slide, please. Now, the action plan, as we've mentioned before, is our blueprint to how we're going to accomplish the CMS recertification and really remain compliant and successful for the long term. We've been successful every month in completing the action items, 126 in January, 133 in February, 77 in March. And it's also happy to note that while this was posted on Friday, we've completed all 122 for April. So they've been submitted, they've been reviewed by the QIE, and they've been accepted as completed. And we're also on track for this month of May. Also, every month, the Quality Improvement Expert reports our progress to CMS, where they author an independent report that, in addition, where they describe the completion towards the milestones, they provide a holistic view around what is happening in the organization, by the organization, and how we're progressing forward. Once we're successful in completing our action plan and have a strong performance in our 3rd monitoring survey, we will be certainly in a position to then apply for recertification. Next slide, please. Exciting updates. So for the hiring updates, as you know, we've been working on really growing and recruiting key leadership positions here at Laguna Honda. They include our nursing home administrator, which is, the most senior chief executive at Laguna Honda, and director of nursing, a medical director, 2 assistant nursing home administrators, an administrator of facilities and capital projects, and a director of emergency management and disaster preparedness. Particularly for the nursing home administrator, we did complete the second round of interviews, and we expect to make an offer soon. It's important to note that we were very excited that the candidate pool was very strong for the NHA role, and so it was really, really exciting to see. In terms of the director of nursing services role, which that NHA and that DON role are such an important dyad partnership for the future of the organization, we have moved into the second round of interviews, and we hope to, in coming updates, provide you really an update on where we are with that, and giving you an update on the successful recruitments for those 2 roles. For the other roles that are above that I've described, we're certainly moving on to recruit those as well, and those are in earlier phases or nascent stages of the review where applicants are being collected, initial intakes are occurring through the executive search agency, and then likewise in future sessions we will give you an update on how those are going. Next slide. Now, also, we've continued and we continue our recertification education fairs. So one was an action plan related training. And as you know, the action plan requires a significant amount of facility-wide education. Several of the categories describe an important focus on ensuring that our staff are being trained and learning these concepts. Now, to ensure the compliance with these key trainings, which include fire life safety, the quality assurance and performance improvement program, huddle boards, we hosted a recertification education fair. This photo is just one snapshot of several sessions like this that occurred over the course of a couple weeks, where over 1,200 staff were trained, which represented a 98% compliance. Our goal was 95% compliance in terms of being the organization trained, and we're just really excited that we're able to surpass that and get to 98%. So it's just, again, the way that these trainings are provided also allow us to focus on really adult learning principles, the ability to speak to someone in person, hear them, hear their questions real time, have them have the opportunity to kind of teach that back and really show some understanding of the content, which has been something that we've started last summer, and we're really excited to see that is becoming a staple and part of our DNA of how we will roll out training.
Oh, Dr. Horton, you're unmuted. Please mute yourself.
Go to the next slide when we're ready. Then staff appreciation. One of the other important things for us to do is that, that we have been on this journey for quite some time, over a year now since we were decertified. Our destination is success and recertification, but we know it's a long journey. And so one of the things that's important for us is to ensure that we're able to highlight and celebrate the staff and ensure that we are appreciating the staff as we're able. This last week, we were able to do food trucks that are across all shifts to celebrate our staff as a way to appreciate their continued work to recertify Laguna Honda, support their morale, and really ensure that we work with also our union partners to help celebrate them. At this particular event, our union partners were there, were tabling, and it was just a really awesome experience, and it was pretty festive, and really just shows you a snapshot of how day-to-day the synergies and the partnership and the energy within the organization really is growing and being cultivating to really a prime ecosystem of just success and optimism. Next slide, please. For this particular slide, we're talking about the closure plan. So as I mentioned before, on February 1st, CMS agreed to the city's request to continue the pause of involuntary discharges and transfers of residents until May 19th. Now, even though CMS has continued the pause of the involuntary discharges and transfers, they still require an approved and revised closure plan. We are hopeful that we will never have to put that plan in action because of the progress I've been describing in the aforementioned slides and in also in the several venues where we have the opportunity to present updates. But because of those continued improvements and our goal and our focus on being recertified, the goal is for that to sit on the shelf. But based on our progress and the negative impact to residents, if the transfers were to resume, we did request that CMS continue the pause on involuntary resident transfers. So this allows us the time that we need to recertify without having to transfer anyone. At Laguna Honda, we have notified the residents of the updated closure plan. And I do want to note that the request to extend the pause on the closure plan implementation was sent to CMS, and they are now reviewing it. Next slide, please. Just a little bit more about the resident rights and safety in the appeal process. So we're really, I did mention a little bit in terms of the descriptor earlier, just around the discharge process, but this is talking, again, more holistically, that we are working hard to ensure that everything is done possible to make sure that the revised closure plan is never put into action and we can continue to care for our residents. If, however, CMS did require Laguna Honda to restart the involuntary transfers, the residents do have the right to appeal that transfer or discharge. We continue to advise our residents of their rights. We work closely with our ombudsman as required by CMS and CDPH. Our ombudsman has a strong presence at the organization. We continue to work hard to make sure that continues and that everyone has access to any resource that they may request in terms of learning more about this. Laguna Honda does not adjudicate the appeals, I think, just to be very, very clear, and those are instead overseen by the California Department of Healthcare Services or the Residents' Health Plan. And I believe the next slide is the last slide, and this is our standard slide that we share just around admissions, discharges, and expirations. Across the top there, you see the summary of what is reflected in the grid below, and new admissions have been on hold and have been on hold for about a year now, which is why starting in the May 2022 box, it shows 0 across. So I will stop there. I believe that's the conclusion of the executive report slides. Happy to take any questions before I yield the time to my colleagues.
Shall we look for public comment?
Yes, there's one hand raised. Caller, you're unmuted. Please let us know that you're there.
I am, Mark. It's Patrick again. I just sent you that corrected sentence. It's still within 150 words. Check your email, please.
Okay, well, I'm not doing that now, but would you like the slide to be shown?
Yes. Okay. And then I'm going to start my 3 minutes. Here I go while you're putting it up.
No, actually, Mr. Menechal, give me a minute to get there because give me 1 second.
All right, and then I'll start my 3 minutes.
Yeah. Okay, here we go. You may begin. I've got the slide up.
All right, thank you so much, Mark. As my written testimony submitted shows, Laguna Honda racked up 138 citations in the 3.5 years since the patient sexual abuse scandal in 2019, plus the other 123 divisions deceased during that mock survey rehearsal inspection. That led to Laguna Honda's decertification exactly a year ago, which hasn't been fixed yet. You can see from this slide, it starts 55.9 million in expenses, 27.4 in consultant, 27.4 million in consultant and other decertification expenses, 2 million in growing in patient sexual abuse penalties, fines, and settlements, 3 million plus in the first public guardian elder abuse and sexual abuse settlement, another class action suit languishing in Superior Court, plus the 23.5 million in lost Medi-Cal revenue. That 56 million was due entirely to the gross mismanagement of Laguna Honda Hospital by managers lacking experience in running skilled nursing facilities, who were running, as Mr. Pickens and the QIE noted, were running Laguna Honda like it was an acute care hospital. Managers responsible for this mismanagement should all be terminated. Many of their names appear in those Superior Court lawsuits. Myla Croce is a named defendant in at least one of those cases. Laguna Honda hasn't had a licensed nursing home administrator for 20 years since Mr. Funk was forced out. That position must be hired and onboarded rapidly, and then the nursing home administrator should report to Dr. Colfax, not to the SFHN management team which I will remind you was created to set up and coordinate the 13 community-based health clinics, not created to manage Laguna Honda Hospital or manage SFGH. The Health Commission needs to fix the management structure that for 20 years led to the Laguna Honda's decertification. Thank you.
All right, that is the only hand that I see. Oh, actually, I want to check, because the number of attendees, let me just check real quickly. Refreshing it. Okay, yes, that is the only, hand I see. So commissioners, it's up, the floor is yours.
So thank you for your presentation. Commissioner Green.
Yes, well, thank you. And it's very good to hear that the staff felt appreciated by the appreciation efforts with the union, that you have met so many milestones, and also that the work you're doing to be so thoughtful and thorough in placing residents who no longer qualify is underway and being done so well. I wonder if you could elaborate a little on how long you think it will take for those residents to actually find not only housing, but also to ensure that all of the support necessary, all of the various agencies and case management will be well established and available. Do you have a timeline for that? And what is going to be the greatest barrier?
Yeah, that's a great question. I think a lot of folks are asking and wondering what the specific timeline could be to help estimate that. And it's really it's really hard to indicate and say. I think because of the complex needs, and as we're evaluating our residents to determine, sometimes the needs evolve or they shift and change. Sometimes it takes upwards of a couple months. Sometimes it takes longer than that. But we know that our goal is to not sacrifice any of the quality steps I described for the sake of any perceived timeline. We want to make sure that the residents that are there, that their needs are being met wherever they end up going. And so that's, I think, the challenge for us. I think one of the biggest barriers is just exactly that. All of our residents have unique and have had unique challenges related to how they can live their best lives, have the most optimal conditions to then do that. And so for us to coordinate the resources, which I'm really thrilled that we have that core team that's been assembled, and we now have the right people at the table to help us coordinate that. If there's a resource or an optimal setting in one place but we can't achieve it, how can the other folks at the table help us achieve that, or move past some of the barriers that exist? So I think the biggest challenge for us is that finding a location that can meet all the needs. We want the perfect settings. I think we strive for perfection, and I think that's the challenge with a lot of the work we do. We care so much about our individuals that we've been caring for. We want to make sure they go to the best possible place. But for us, we're working through to figure out how do we find a location that is the best location for them at this point in time, where they can still continue to thrive. So I think it's just, I hope we will start to collect some data in the coming months that can start to help answer that question around what's the average that we're seeing. What are the common denominators of some of the challenges, whether the acuity might be too high for one location, but not quite where it needs to be for a different. And so our goal is to start to bring some of that information and share that a bit more. But we do know that the challenge is just making sure that with the complex needs that each resident has, finding that right balance of that right intersection of where they can go.
If a resident wants to stay in San Francisco after discharge, do you see any barriers to that? And also a correlate is, do you have any sense for how many people might want to be placed out of San Francisco County? Because that may have an impact on finding the best support services for them.
Yeah, I think, as we work through this, one of the key parts of this process that we've developed and that we're working through is really engaging the resident as well and kind of their desire. I think it's hard to provide a specific, kind of a generalization. I think we certainly have residents that want to stay in San Francisco, that they do not want to leave. We have others that are open for an opportunity to not be in the city, but where they can achieve that optimal experience and that optimal way to kind of live their best lives. So it's not in one way or another, but we are working with those groups of the core team just to ensure that we are casting a wide enough net, that where can we find the location or setting that do best for the resident, and then engaging them in the process and being at the center of this.
Great. And then the last thing I wanted to ask is, given that you're so close and it's so encouraging that you're this close to finding an administrator, is there any chance that maybe they'll bring a bit of a team with them so that you would be able to accelerate filling some of the other positions that are so critical on the list?
Absolutely. I think that's one of the benefits of having retained the expert search agency to do these recruitments. I think one of the intakes, or an intake question for all the positions, but particularly the nursing home administrator and the director of nursing position, has been reaching out to say, do you know, other recommendations for other candidates who might be interested in this experience. Anyone who might have had create a strong partnership with colleagues or others where they were able to really develop and bring an organization from a certain level to a higher level. Sometimes, you know, when that lightning strikes, you want to recreate that and keep it. And so we certainly have included that question, and the team from the search firm has included that question as part of the intake process. We're pleased to see that some of the, you know, that they have confirmed for us that some of the recommendations were entry points into some of those different searches and the different elements there. But, you know, each of them is also then their unique lane of kind of their evolution as they go through the process. But we're hopeful that as we are going through it, those synergies and those working relationships will start to bubble up a bit more, both in just terms of, you know, principles and values, right? You would assume that there's individuals that work strongly together have shared principles and values. And in our mind, if a principle and value aligns with where we're taking Laguna Honda, where we want Laguna Honda to be, not just in the immediate future, but for the long-term future, our goal is then those values will bubble up and we will find that alignment and that kind of perfect balance of the leadership we want here.
Great, thank you.
Absolutely, thank you.
Thank you for the description and on the process that we're now using for those who no longer qualify for SNF. Is that around 40 people or so? Is that, did I remember that correctly? Or?
Yeah, it's a little north. Yeah, it's a little north of 40. That's correct.
Okay, and within that, and within this structure, although you've described the resident, what about the resident's family, and or the guardian? Where do they come into this role of, you know, being consulted?
Absolutely. I think that's, as a resident, if they are able to, if they are their own decision maker and they're able to be part of that the conversation, we want to make sure we honor their request. So if there is a request that, you know, I Baljit Sangha, want to make sure that I have one person that's important to me as part of the conversation, we try to make sure we are as focused on this. You know, we continue to strive towards the individualized care for our residents. So if they're saying that I want an individual to be a part of this conversation within the guidelines that we have and the parameters, we will love to include them. I think that only adds an additive element of a positive conversation to occur. If there's an individual that wants to have a representative, or there is a representative assigned or guardian, or that's part of the conversation, we certainly engage with that person as well. And as I mentioned, the ombudsman and other advocacy entities are also often and always welcome to be part of the conversation as requested. But that's always the goal, Commissioner Chow, if we're able to include that, because we find that leads to a more positive and a more productive conversation versus not.
Okay, and lastly, in regards to the appeal process, I had understood from a prior iteration of this, without the detail that you've had in terms of the core team, that the appeal process would go to the health plan. This is the new system, right, under the new Medi-Cal managed care. So is it that, because you mentioned they could also appeal to the state, is this a hierarchical thing where you have to appeal the health plan first and then the state, or people are allowed to go directly to the state and bypass the health plan?
Well, the appeal goes through the managed care plan. So in this case, it would be the health plan. I think the DHCS Office of Appeals is also there and available as, you know, as a backstop in case there were an event where there, for whatever reason, wouldn't be able to go to the health plan. But the health plan is the first stop for us. And those entities are, you know, the goal is for them to work together for a productive and positive outcome. But it would be the health plan is where the initial conversation would occur.
Okay. And where does the state then come in? Is it after somebody then wants to appeal the health plan's, you know, decision? or they, because you said they kind of cooperate together. So is that the end of the appeal, or that's what I'm trying to get to? Or is there another level that they can get to the state?
No, so once, that's a great question. At this juncture, what we're working through is those actual process steps with DHCS and the health plan. But the idea is that once DHCS has also been involved, that at the state level is that final element for them to work through and have that appeal. We are looking through and trying to learn more about exhausting all the options of the different steps available to our residents as they work through this, but that's really where the state, as that DHCS as the entity, would come in and provide that level of either adjudication or additional wayfinding for where do we go from here.
Okay, so I guess what we'll do is you can bring us up to date on those areas and the progress that you're making at our next opportunity, as you know, as you get experience within your system.
Absolutely.
That would be good. Okay, if we have no further questions, we'll go on to our next item.
Okay, great. Thank you very much, Baljeet.
Thank you.
The next item, item 5, is the hiring and vacancy report.
Hi, good afternoon. The Laguna Honda vacancies increased in April to 12.6% from 12.3% in March. We've hired a total of 26 employees between April 1st and April 30th, 2023 in various classifications, and had 3 separations during the same period with one of those retirements. The RN vacancy rate decreased to 8.7% in April from 12.9% in March. The hiring managers are making selections from a refreshed long-term care eligible list, and we have 18.5 RN vacancies to fill. HR conducts regular vacancy meetings with program and hiring managers to review hiring. Some RN highlights: 9 FTE were filled in April, 11 2320 RNs were selected by the hiring manager in April. And then non-RN hiring highlights: the 0942 SFHN Executive Administrator for Support Services is targeted to start on May 13th. The 0941 Administrator of Facilities Services and Capital Projects is targeted to start on May 29th. 4 2312 LVNs have been selected in April, and as of May 2nd, 28 hires are on the orientation schedule for May 2023. Thank you.
Shall we look for public comment?
Sure. So folks, we're on item 5. I see one hand, so I'll just unmute that person. Mr. Manette-Shaw, you've got 3 minutes.
Thank you, Mr. Morowitz. Commissioners, it's troubling that the overall vacancies have increased again in April to 12.6%, having a total of 186.9 FTE vacancies. It's worrisome the lower level job classification codes providing direct patient care or are short-staffed, which must put stress on the entire team caring for patients. There are 2303 patient care assistants have 50 vacant positions for a vacancy rate of 12.5%, and the job classification code 2583 home health aides has a vacancy rate of 31.1% with 19 vacancies. I'm really hoping that a licensed nursing home administrator is onboarded soon and may bring some stability to the staffing at Laguna Honda to help finish demonstrating to CMS that you're prepared for recertification and that you can resume admissions as quickly as possible. But again, I firmly believe the nursing home administrator should report directly to Dr. Colfax, not to a entity that was stood up for the community-based care clinics who has exceeded their intended organizational structure. That nursing home administrator should be free of interference by acute care hospital administrators who mistakenly have been running Laguna Honda like an acute care hospital, as both the QIE and Mr. Pickens have acknowledged was one of the original sins that led to decertification. Mr. Funk used to report as a licensed nursing home administrator to then Director of Public Health, Ms. Katz, and you should resume and return to that model of organizational structure. You have that within your power. It's the governing body for Laguna Honda, and you should do so. Thank you.
All right, we have one more caller. Caller, I've unmuted you, and you've got three. Oh, I'm sorry, wrong. Here we go. Caller, I've unmuted you. Please let us know that you're there. Mr. Persico?
Yes, can you hear me?
Yes. Yes, yeah, you've got 3 minutes.
Okay. What I want to say is that it's important to consider when you're hiring someone to be responsible for Laguna Honda Hospital, that there's got to be constructive, corrective feedback loops into the oversight of Laguna Honda so that its standards of care will likely never again diminish. New administrators of Laguna Honda must be hired who are highly qualified and adhere to best practices for long-term care with frequent accountability measures that will ensure that there will be a proactive or corrective action taken to prevent lowering of its performance below a certain level to ensure a level of public long-term care which we in San Francisco will be proud into the future. Thank you.
All right, thank you. And we did have another hand come up while he was speaking. All right, caller, we're on the human resource report, so public comments need to be around that. You're unmuted. Please let us know that you're there. Caller? All right. So no more public comment, commissioners.
Thank you. Commissioner Green?
I had no questions about the vacancy report.
Okay, I also appreciate the work that the human resources people have been doing. I think it's amazing that we are able to find nurses, and at least that level has gone down. But and it appears that we are in the process of also at the moment working on patient care assistance, and so I think we want to thank the Human Resource Services for their continued outreach and working with administration on this. Thank you. Let's go on to the next item, please.
Yes, item 6 is the Regulatory Affairs Report.
Hi.
Hello?
Hi.
Yes, please begin.
Hi. Good evening, commissioners. I'm Geraldine Mariano, Director of Regulatory Affairs, and I'll be sharing the Regulatory Affairs Report for Laguna Honda Hospital. The report reflects activity for the month of April 2023. We had 19 facility reported incident to CDPH for the month of April and received 3 anonymous complaints. We also had 1 unannounced visit from CDPH in April for follow-up of FRIES or facility reported incident investigation and anonymous complaints. Excuse me. Laguna Honda is expecting its third 90-day monitoring survey, likely mid-May or early June. If you have any question or comments I can address at this time, please let me know. Thank you.
Thank you. Let's look for public comment.
Yes, sure. Folks, we're on item 6, Regulatory Affairs Report. If you'd like to make a comment, please do so about the Regulatory Affairs Report. And I see one hand. Mr. Manette-Shaw, you may begin.
Thank you, Mr. Moritz. It's troubling again seeing in this report for the May period for regulatory affairs that there were 2 major injuries. I had, as you know, worked in the Rehab Services Department as the secretary supporting the PTOT and ST staff and the physiatrists, Dr. Pasquale, Dr. Trin Tran, and Dr. Chris Hennett. And I know that Laguna Honda had made major efforts under Paul Carlisle's leadership around falls prevention. So seeing that there are still major injuries occurring is it's troubling. And I hope that you have enough staff and no vacancies in the PT and OT department. They may be contributing, however, inadvertently to resident falls. And I hope you will take a close look at your falls prevention program again. Thank you, Commissioners.
That is the only public comment for that item.
Great. Thank you. Commissioner Green?
Yes, well, thank you for the report. I think the main question I had, and I am concerned obviously about the injuries as well as the staff to resident where there may be a deficiency, but do you have any sense, given that we have surveyors here, the speed with which we will have investigations begin? Will it be faster because they're on site, slower because, of course, we're all kind of COVID traumatized by how long many of these have sat unaddressed, and we'd like to clean our slate and move on. But I wondered if you have any sense for how having people here as part of recertification will affect adjudicating these, and secondarily, whether any of these could threaten the recertification or slow the recertification process.
In terms of investigation for our facility reported incidents for Laguna Honda, we investigated it on time. So it's, I don't have control on the, when CDPH do their own investigation to our reported incidents. So I think they're trying their best to like look at the fries that we reported, but there are still some that are not being investigated. Did I answer your question correct?
And do you think it would do anything to affect speed of recertification?
Good evening, Commissioners. I apologize. I'm with Geraldine in the office. So in regards to the question in terms of recertification, so the answer for that is dependent on the findings. So in theory, the 2 pathways are separate, right? The review for certification and then the review of the facility reported incidences. However, if when they come on site and they, for instance, review an anonymous complaint and feel that their finding is significant, then potentially there could be, those 2 tracks would collide, if you will, right? But current practice is they are 2 separate review processes. I hope that helps.
And do you have any sense of whether things will happen in a more speedy manner because they're on site so much now?
Unfortunately, no. We like to feel that it's happening more quickly because they're here so often. But as you know, Commissioner Green and Commissioner Chow, from the numbers, it just continues to be over 100 cases pending in our log for CDPH review. We have reached out proactively to ensure that our log matches theirs, and we are waiting to hear back from them so that they can provide us their updated information. For instance, their log indicates that all cases from 2019 have been closed, but as you know, our log does not show that. So we do want final confirmation from them so we can ensure we're both aligned.
Thank you very much.
Yeah, I note on the Fry report that there's a whole block that they haven't even started on in 2022 that just goes on, but they do seem to take all the anonymous complaints and work on those. So it's very interesting that we have a whole block that they still could, and will come back and review yet. I'd imagine, but I'm glad you're doing an inventory on them with the state, and possibly, let's hope some of this might be overstated. So keep us up to date on how the state adjudication, along with yours, will pan out. But I know Commissioner Guillermo continues to be concerned that there are so many outstanding, going all the way back now to at least 2021. So I don't see any other questions that we have. We can go on to the next item, please.
All right, thank you. Item 7 is an action item. It's the Laguna Honda Hospital policies.
Good evening, Commissioners. Today I have 18 policies and procedures to present. There are 10 hospital-wide, 1 new one, 20-02 hospice care assessment and transfer discharge process, 9 revisions, 2207A01 restraint-free environment. We added the language regarding restraint-free environment, remove entrapment definition, and refer to the bed rail policy. Also remove the restraints for emergency situations, which is reflective of the acute environment. And we also removed the bed rail section. 2210, management of resident aggression. We added the LHH behavioral response team throughout the policy, and we updated to the current practice. 2211, resident freedom from abuse on social media. We added written consent is required, and LHH shall post signage that photography and video recording is prohibited. 2212, clinical safety search protocol. We added the BERT team support and SFSO to San Francisco Sheriff's Office. The deputy shall be contacted if needed. 24-06, resident, patient, and visitor complaints grievances. We added the administrative director shall act as the grievance officer. We updated the policy to reflect current process and added new grievance data and reporting committee sections. 24-16, code blue, we added language around no PHI will be entered into the system. 50-02, resident trust account, we updated the policy to reflect current practice and response to the first 90-day survey. 72-01, C23, pneumococcal immunization, we added the pneumococcal polysaccharide vaccine and or pneumococcal conjugate vaccine as defined by most current pneumococcal vaccine recommendations. 75-10, Appendix H, visitor screening process. We replace security provider with the Sheriff's Office, SFSO. Onto departmental, we have 8 departmental. The first one is outpatient clinic. There are 2 deletions. First one's A4, clinic appointment scheduling for community clients, and C6, steam sterilization. For the EBS departments, there were 2 revisions. The first one is 10, equipment, supplies, and chemicals. We added microkill germicidal wipes to chemical, ready for use. Policy 17, transport delivery, time for biohazard trash and linen. We added and updated the clean linen delivery section. Next department is FNS, 1 revision, 1.1, food from home or outside sources served directly to the residents. We updated the policy to current practice. And finally, nursing. There are 3 revisions, K 1.0, assessment and management of pressure injury. We updated the appendices and language around wound care charge nurses and trained wound care champion registered nurses, or physicians can identify and stage pressure injuries. K 3.0, wound irrigation and cleaning. We revised to incorporate the, I hope I'm saying this correctly, Bosch product. K 10.0, prevention and management of skin cares. We added a new section, background statement and management skin cares, and updated policy to current practice.
Can I get a public comment?
Yes, please.
Sure. Folks on the line, we're on item 7, the Laguna Honda Hospital policies. I see one hand, so I'll unmute that person. Mr. Monesh, you've got 3 minutes.
I'm sorry, I meant to lower my hand. I'm done for today. I hope you guys have a good evening.
Okay, great. Thank you. All right, no public comment, commissioners.
Commissioner Green, any questions?
Yeah, the only question I had was the extent to which our consultants have reviewed these policies, especially in light of some of these, especially the restraint policy refers in part to phase 3 changes. So have they also reviewed these and felt that they will, pass muster going forward with the new and future regulations?
The restraint policies are reviewed in partnership with our consultant experts. They are part of the restraint work group. Absolutely.
Great. I just wondered, that they had also looked at this as well.
Yes.
Great.
I wanted to appreciate the summary on the departmental policies and procedures. They were very helpful and sufficiently detailed so we knew what we were looking at, and so thank you for that. I had only about 3 comments. The first was that the abbreviation SFS0 has been apparently consistently used except for in your file 2210, in which you actually use SFSD. So I'm not sure which one we are using. Do we want to call it an office or a department, or is there a preference that we are following now, and you might want to change that, whichever?
Thank you, Commissioner Chow. We will update that as we go through the policies. We've been trying to update to SFSO. That is their new term, or that's how they refer to their office now instead of department.
Okay, thank you. Under the same file, under your Appendix 1, you have a flow chart, but I'm wondering, and perhaps it's within the flow chart so you can help elucidate where the behavioral team might be, where the BERT team would come in. Is it in one of these boxes, or it doesn't come in under the behavioral management flow?
I apologize, for which policy, Commissioner Chow, the flow chart, so I can pull it up?
Sure. It's 2210 Appendix 1, and you have a very nice flow chart. And I know that you've been describing how the BERT team will be of assistance during these incidents, and I'm wondering, is it subsumed in one of these boxes where they're either called or come, or that is where do we, within the flow, bring a BERT team in?
Thank you for that question. We'll have to follow up with you, as I also don't see that clearly outlined in the flow. I do acknowledge that Ms. Terry D'Antoni is on the line, so I'm not sure if Terry can speak to when they would be brought in, but we will definitely follow up.
Okay, very good. The last comment is on 2416, the code blue. And I was trying to understand under your item 16 on page 2 that you say CPR data is collected and managed via the defibrillator. And I'm trying to find out how the defibrillator actually manages this data. I always thought it discharged voltage.
From what I understand from the statement in the team, is that the software system that is connected to the defibrillator saves that information. And the Code Blue Committee, which is a select group of team members within the facility, has access to that data. I can get more kind of concrete system flow from them if you would like, but unfortunately, I'm not familiar with the software.
Okay, so as part of the software within the defibrillator that is collecting data, that we are looking at the data within that and not the
Correct.
function of the defibrillator itself.
Correct, yes.
Okay. All right. Those were my only questions, because I thought it was very well done, and it was really great to see some of the questions that have been raised by the regulators really being addressed now in the policies. So thank you very much.
Thank you.
I think we're prepared for an action item, which would mean a motion is in order for the recommendation of the policies and procedures to the full commission for the consent calendar.
Thank you.
Yes, I would make that motion that we refer this for approval by the entire commission.
Okay, and I would second that, and you want us to also take a yay or nay?
Yes, please.
So, all those in favor, please say yay.
Yay.
Okay, great. Well, I'll add my yay. Thank you so much. We can move on to a consideration for closed session. And before we do that, see if there's any public comment. Folks, we're on item 8. If you'd like to make comment about a closed session, please press *3. I see no hands, commissioners.
Okay, so we're prepared for a motion for a closed session,
So moved.
and I would second that. All those in favor, please say aye.
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 All right, thank you. Folks from the public, you will not see or hear us while we're in closed session, but we will be back if you'd like to wait. Everyone else, please give me about 30 seconds to take us over to the closed session. Okay, we're back in open session. Please, commissioners, please consider a motion to disclose or not disclose discussions held in closed session.
So a motion's in order,
Move not to disclose.
and I would second that. All those in favor of the motion, please say aye.
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 And now a consideration for adjournment.
Move to adjourn.
And I would second. All those in favor of adjournment, please say aye.
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 All right, thank you.